Hey there, Dr. Anthony Crifase here, and I'm so excited that you have joined this webinar. This is going to be truly life-changing for you, and I can't wait for you to watch it. But before we begin, I would just like you to imagine how you would feel if you were able to resolve and reverse your diabetes or pre-diabetes condition naturally, because that is exactly what we're going to be covering today. I'm going to be taking you through my exact approach that has been able to reverse many patients' diabetes conditions and pre-diabetes. So please turn off your cell phone, all distractions, and give me your ultimate attention for the remainder of this video. Now, if you're like most people, you're tired of the same old conventional approach of medication after medication with no resolution in sight. We are talking about things like metformin and insulin. Not only that, but you are tired of paying your hard-earned money for these medications and procedures year after year with no actual indication of progress. As you will learn in this webinar, the average diabetic patient spends over $10,000 annually on medical bills related to diabetes. So I'm going to take a guess that at this point you are open-minded and would like a natural solution to your diabetes or pre-diabetes condition. Now, it's very important to understand that there is a distinct difference in the mainstream or conventional model of care and treatment and what's known as a functional medicine model of care and treatment when discussing diabetes. The mainstream model of care relies on medication and manages symptoms only, whereas a functional medicine model, the same one that I utilize and that I will be going in depth on this webinar, digs deep to find the root causes of your diabetes or pre-diabetes or blood sugar problem. In this webinar, I'm gonna be going over a lot of information, but don't worry, as you'll be able to access this video once I'm done. And me and my team are here for you if you have any questions or concerns. So without further ado, let's begin. Hey there, Dr. Anthony Crifase here, and today I'm really excited that you're joining me in this webinar, in this video. We're gonna be talking about how to conquer type 2 diabetes and pre-diabetes with functional medicine. Now, this is a really important video here today because there's a lot of people suffering with these conditions in the world, and most people are seeing their mainstream medical practitioners and they're just being placed on medication or insulin or both, and it is not a pretty sight. So I hope you pay attention to this video because I can promise you, you're gonna be learning a lot and you're gonna be taking home a lot of information that you'll be able to apply so that you can get to the root issue and finally resolve your type 2 diabetes or pre-diabetes. Now, before we begin, I just want to clarify that if you're on medication, I am not telling you to discontinue your medication, and I also do not monitor prescription drug medication. Anything that you are on with your current doctor, any medication, needs to be monitored by you and the prescribing physician. So I just want to be clear that I'm going to be going over all of the other ways that you can attack and conquer type 2 diabetes and pre-diabetes. So really, really important video here. So a little bit about me. I have an extensive background in the health and wellness industries, and I've helped numerous amount of people, not only who are suffering with chronic health conditions, but also resolving their type 2 diabetes and pre-diabetes. So the prevalence and cost of type 2 diabetes and pre-diabetes in the United States is outrageous. It's estimated that about 30 million Americans have type 2 diabetes and 7 million don't even know they have it. Now, that's just crazy. There's lots and lots of people who are suffering from this, and this comes down to improper blood sugar over a period of time. 34 million have pre-diabetes on top of that 30 million with type 2 diabetes. So essentially 1 out of 5 Americans has a blood sugar problem. Now, this is not that surprising as the standard American diet is loaded with processed foods, sugars, and much more that I'm sure you are aware of. Now, the most staggering statistic out of all of them is that the average medical cost for a type 2 diabetic per year is $13,700. Now, if that is not blowing your mind right now, I'm not sure what. And the sad thing is that these people are paying this amount of money every single year, year after year after year, with no resolution in sight. It's not like they're paying this one time and then it's oh, guess what? We're going to get to the root issue. It's that they're paying this year after year after year, and there's no resolution. And there's not even a attempt to get a resolution. So that's a huge number, and that's a very unfortunate statistic. And the good news is that we can help this, okay? You don't have to spend that much money every single year if you're dealing with diabetes. That's an outrageous amount of money to spend on any health condition. So type 2 diabetics spend 2.3 times more on medical costs than non-diabetics. As you can see, this is a big problem. And so, as I mentioned, we're going to be talking about this today. This is really, really important that you need to understand there's ways to get to the root issues of type 2 diabetes and pre-diabetes. There's ways that you can get to the underlying causes so that you can finally go on with your life, be off medication, and feel like you're $1 million again. So the diagnostic criteria for type 2 diabetes from the American Diabetic Association is fasting blood glucose at 126 at 2 separate occasions, or hemoglobin A1C greater than or equal to 6.5 at 2 separate times. All right, we're going to be talking about this a little more. Now, the criteria for diagnosing pre-diabetes, which is an increased risk of type 2 diabetes, is a fasting blood glucose of 100 to 125, or a hemoglobin A1C of 5.7 to 6.4. Now, you don't even want to be at a pre-diabetes risk because, as I'm going to be showing you, this sets the stage for many, many other chronic health conditions. So what are we going to be covering today? You know, everybody knows and everybody says the same thing. Well, just eat a healthy diet and exercise. If you have diabetes or pre-diabetes, or you want to lose weight or anything, or if you have high blood sugar. But I'm going to be going over the 10 causes that are not related to that whatsoever. You see, when you have type 2 diabetes or pre-diabetes, you're past the stage of the basic dysfunction. So when you have a chronic health condition, there's a kind of a line that starts to ramp up. So it takes years and years for this chronic dysfunction to occur. And at one point in time, you're at the apex. And at that point in time, you start to develop symptoms. And say you fall off the edge, that's when you start to have symptoms. That's when you have problems. That's when you go to your doctor and they say, wow, your A1C is at a 6.5, and you get diagnosed with type 2 diabetes. Here's the thing though, there's a lot that is happening underneath this curve at that point in time before you get diagnosed, before you develop symptoms. And so there's a lot that needs to be addressed other than just looking at diet, other than just doing exercise. And in fact, a lot of these things, fad diets and doing rigorous exercise programs, can often impact things for worse. So it's important to know how to do them properly. So I'm going to be discussing the consequences of high blood sugar on the body, which there are many, many. The consequences of typical diabetes medication, that if you're watching this and you have diabetes, chances are none of this has been ever explained to you, unfortunately. That's often the case. And why checking hemoglobin A1C is not enough, and how medications, one that you might be on, only slightly reduce this. This is a really, really important point we're going to be talking about. And how functional medicine and a functional medicine model can put most pre-diabetes and diabetes into remission. Yes. So there's a basic understanding of how this works before we go on. When you consume food, your food gets broken down into glucose, which is known as sugar or blood glucose. And it's used inside your cells for energy. So it has to get inside of the cell. Now, if it's outside of the cell, it's essentially useless, and it causes a lot of damaging effects within the body. So chronically high blood glucose is very dangerous. So we'll talk about this more. Now, insulin, which is a hormone made in the pancreas, is the hormone that takes the glucose outside of the cell and puts it into the cell where you can use it for energy. So in order for insulin to allow glucose into the cell, it's kind of a lock and key mechanism. Insulin opens the lock and allows glucose to enter it. It must activate a receptor site on the cell, an insulin receptor site. So here's a really important point that we're going to start talking about. One of the main important points yet. So the big picture is when you have too much blood glucose in the bloodstream and not in the cells, you get a lot of problems. Now, the major two types are type 1 diabetes, which is due to an autoimmune process and destruction of the pancreas. Okay, and this often causes low insulin production. And with type 1 diabetics, they are on insulin for the rest of their life because they've destroyed the pancreas so that they're no longer producing insulin. So they actually have to take that to survive. Now, a type 2 diabetic is where you have too much insulin, and I will discuss this in a second. And this is due to too much high blood sugar in the first place. Now, there's a third type of diabetes, and this is called type 1.5. This is known as latent autoimmune diabetes in adults, or we will call it LADA. And this is a combination of type 1 diabetes and type 2 diabetes. And I'm going to go over this here today. So, too much insulin causes the receptor sites on the cells to become desensitized. And this is what we call insulin resistance. Now, I want to give you this example. If someone was knocking on your front door for a minute or 5 minutes, you might realize, hey, somebody's knocking on the front door. But if they continue to knock for an hour or 3 hours or 5 hours, you're going to at one point tune that out. You're going to become desensitized to the knocking. You're not going to care anymore. So this is the exact same thing that happens in the body with hormones, including insulin, which is a hormone. So when the blood glucose is too high, the insulin starts to raise, but over time, the insulin stops responding. And so it starts to become resistant to the blood glucose. And what happens now is the insulin stops responding and the blood glucose continues to rise, creating more damaging effects in the body. So again, all of this is due to too much glucose in the blood, causing the pancreas to release high amounts of insulin, but not responding. But the question is, why is there too much glucose? So, causes of high blood glucose. Well, as we discussed, yes, poor diet can cause this. Lack of exercise can cause poor glucose management levels. But what else? There's a lot of other things that we need to look at when we're addressing chronic health conditions, including diabetes and prediabetes. So here are the top 10 underlying causes of high blood sugar that are not related to diet and exercise. And again, this information, I have yet to talk with patient and client who has diabetes or prediabetes that they're seeing their mainstream model doctor for them to go over this information, because that is not part of the mainstream. This type of information is not discussed. What is discussed in the mainstream is you come in, you get your blood glucose and your A1C checked. And if those are out of range, you'll be put on medication or insulin. That is basically it. And then you're on it for the rest of your life. Now, I know, and hopefully you know, and by the end of this presentation, I believe you will know definitively that there are other ways to resolve and to manage your type 2 diabetes or prediabetes other than just taking a medication for the rest of your life with no end in sight, as well as we discussed the overall costs, which are up in the tens of thousands per year paying for diabetes and the repercussions of this. So, number one is poor thyroid function. I see lots of patients dealing with thyroid function that is directly related to their blood sugar, and let's discuss this. Poor liver function, poor adrenal gland function, systemic inflammation. And when we say systemic, we're meaning it is in the entire body. It is reaching every aspect of the body. Autoimmunity against the pancreas, poor digestive function, nutritional deficiencies, medications, polycystic ovarian syndrome, which is often very related to type 2 diabetes and prediabetes, and many, many women are now developing this. Younger women, at least 10% of the population, 5 to 10, give or take, probably more, is starting to develop this. And this is chronically related to chronic blood sugar issues as well. And then finally, neurologically induced high blood sugar. So you can see there's a lot more going on besides just diet and exercise. And to say someone just go work out, go run, and just eat right, it's very vague. We want to get to the root issues of these things. So the key point that I really want you to understand here today is that taking medication does not necessarily address these underlying causes, and it has serious side effects. Any medication, any prescription pharmaceutical medication, number one, you always have side effects, and number two, you get nutrient depletions, and we'll be discussing this. So if you eat a high meal, a large meal, okay, this is how you're going to get chronic high blood sugar. So you'll eat a large meal, a high glucose meal. What's going to happen is it will start to enter the body. Now, number one, if you have high blood glucose and insulin resistance, what's going to happen is that glucose is not going to get into the cell, okay, as we discussed. What's going to happen now is you're going to have high blood glucose for a moment, and then you're going to crash. So this is going to cause fatigue. So if you're eating breakfast, lunch, and dinner, and after your meal, you're becoming tired, then it's pretty indicative, and this is another important point, that you may have some insulin resistance or pre-insulin resistance or pre-diabetes. So these are really important things that we need to be monitoring going forth that can be managed, that can be reversed. So you have high glucose after the meal. The glucose becomes elevated, you crash. Now what happens is that blood sugar, that blood glucose immediately turns into fat, and that is known as lipogenesis, okay? So this also causes more energy, which is why you can feel even more fatigued after meals. Now, lipogenesis, creating fat, essentially you're going to create more triglycerides, you're going to create more cholesterol, you're going to create more LDLs, which is known as low-dense lipoproteins. These are known as your bad cholesterol. Now, you go to your doctor, and after this is going on for years and years, as we've discussed, or even months and months, this can happen. You go to your doctor and you have high fasting blood glucose. Your A1C is elevated, your hemoglobin A1C. And you have high triglycerides, you have high cholesterol, and you have high LDLs. So what's going to happen? Well, guess what? You're going to get placed on number one, a glucose medication, a blood glucose medication, maybe metformin, maybe even insulin. And you're also going to be getting put on a cholesterol medication, most often a statin medication. Okay, now you're on two medications that are caused by the same thing. Instead of going after the root cause, now we're placing you on two medications, and you're just on these forever and ever without looking at the root issue. And again, there's a lot of negative effects of just being on these medications alone. Okay, so hopefully this is making sense so far, that we got to look at those root issues. We have to get to the underlying causes. We can't just be taking pills, you know. And if you're on medication, if you've been through this model of care of take this medication for this, take this medication for that, it is not your fault. You know, the American population is trained in this. So we often, you know, as a young age, if you hurt your leg, if you have a headache, if you have any problem, it's just take a pill, take a pill, take a pill. And what these pills do is, number one, they desensitize your ability to feel that pain, to respond to that pain, but it also desensitizes, and it doesn't allow you to realize, oh, I have to address this. I actually have to take care of this problem. I can't just take a pill and try to manage this symptomatically over and over again, because it's not fixing anything. And what happens is these things fester over time and time and time, and you develop more problems and more problems. So, consequences of high blood sugar. When you have high blood sugar, as we've been talking about, what this actually does is this attaches to a protein, often the red blood cell, or a lipid in the bloodstream. This is what creates known as advanced glycation end products. Okay, we're going to call them AGEs. Okay, what AGEs are these are known as free radicals or superoxides. So if you leave a bike out in the rain and it starts to rust, and it rains and rains and rains, the bike is going to start to rust because it is oxidizing. Okay, so that form of the metal is changing. And so the same thing happens in the bloodstream, to your blood, to proteins. When there's high blood sugar, the sugar will attach to these proteins, it'll attach to a lipid, and this starts oxidizing things. It starts damaging the cell membranes. And this is not good, because oxidation equals aging. And aging equals, as you know, what aging is, but a lot of negative effects occur with this thing. So big important point here. So you get these advanced glycation end products. This has a lot of negative effects in the body. This damages your blood vessels. It can damage all your heart, your arteries, everything, your veins. This leads to hypertension, heart disease, stroke. So two-thirds of type 2 diabetics actually die from this. This is why many diabetics have peripheral arterial disease. They have peripheral neuropathy. They have damaging effects to many different areas of the body, because what happens is these advanced glycation end products, these free radicals start to damage and destroy the arteries, especially the little ones located at the periphery. So near the arms, the legs, near the eyes. So retinopathies, all these other things. That's what I was searching for, that word. So a lot of damaging effects that come from advanced glycation end products. We need to get to the root issue of these things because, again, I'll be discussing this a little more in a second, but if you are just on medication, chances are these things are continuing. They're never actually improving. They're never going away. So you start with high blood pressure glucose medication, then you get cholesterol medication. Then before you know it, you're on peripheral neuropathy medication. Then before you know it, I mean, it just goes and goes and goes. I've worked with many different people who have diabetes, type 2 diabetes, prediabetes, and they're on 3 to 7 to 10 different medications. So it's not a pretty road to travel down. And if you're already down that road, know that there can be things you can do. This still can be resolved and can be improved massively. So advanced glycation end products, we just briefly touched on peripheral arterial disease. This creates a narrowing and a lack of blood flow. When you have a lack of blood flow, you get things like fluid retention, bloating. So problems with bladder retention. Okay, you can't urinate properly. Sexual dysfunction, cold hands and feet. So sexual dysfunction, men with erectile dysfunction, cold hands and feet. The blood is not able to get there. The arteries are narrowing. Okay, hair loss because you're not able to get blood flow, nutrients to these areas. So this not only affects the arteries and the nerves in the veins, but also the nerves. So high blood sugar, these things affect everything in the body. So your hair depends on proteins. You need blood flow and nutrients in order to deliver those proteins to make those hair follicles. And so the same thing goes, there's many diabetics who have fungus on their feet. Well, everybody has fungus on their feet. Everybody has fungus bacteria, but certain people get overgrowth of this certain fungus. And that's because they do not have proper blood flow and nerve flow to get to their feet. And so what happens is it overgrows. They don't have the immune cells to clean it up and to keep it in balance. And health is all about having a balance between things. What else do you get? Bad skin, so thin, flaky, dry, ulcers. Okay, these things are really, really common. And if you are watching this video and you have diabetes or you know somebody's had diabetes, peripheral neuropathy is a very, very common thing. So what first starts to happen is you start to lose the sensation. So you start to get numbness and tingling because the outside of your nerves has a sensory portion and on the inside is more of the motor function. So the first thing you start to lose is the sensory portion of your nerves. This is why numbness and tingling. Oh, I can feel that. It's kind of tingling. It's a little numb. Now what happens is that nerve starts to get damaged more and more and more. And what happens is you start to lose motor function. This is when people develop foot drop. They cannot move their foot up and down. They cannot move their leg. Now what happens again is the immune system, the blood flow, nothing is making its way to that leg, to that arm. So now things start to overgrow. You start to get fungus. You start to get infections. And now what happens is they start to cut off toes. They start to cut off fingers. And then they start to cut off feet and limbs. And as you can see, this is not pretty. This is not a way to live. And there's a lot that can be done so that you do not have to suffer like this. So that's a really common thing with diabetics and prediabetes as well, because it's very rare for someone not to have prediabetes and then not to develop type 2 diabetes. So what else happens? As we just talked about this, it damages your nerves and neurons. Okay, neuropathies, neurodegeneration. This is another really, really big thing. The rate of Alzheimer's and Parkinson's is growing massively. And they say that type 2 diabetics have about a 600% increased chance of developing Alzheimer's. So this is not a pretty sight, okay? Neurogenic bladder, we talked about this. Gastroparesis is where your stomach is not contracting properly. So you have a problem with emptying your bowels, okay? So you might develop things like diarrhea, depression, anxiety, insomnia, balance disorders, vertigo. This doesn't just affect one part of the body, okay? So everything in the body becomes affected when you have high blood sugar, which leads to these advanced glycation end products. These are very damaging things in the body that we must address. We talked about this a little more. So damage to the retina, retinopathies, these are really common. So blindness, okay, damage to your kidneys, 20 to 40% of type 2 diabetics depend on dialysis. Okay, so we talked about this. Poor blood sugar, then you have cholesterol issues, then you have neuropathies, then you have kidney problems. Do you see how this road just keeps going and going and going with no resolution in sight, and how these medical bills can just get stacked and stacked and stacked year after year? Damage to the eyes, type 2 diabetics, 40% increase for glaucoma, 60% increase for cataracts, and macular edema, loss of fine detail vision, and poor night vision. You don't want to go down this road. And if you are dealing with these things, again, there are ways that you can get to and uncover the underlying issues and address them so that you don't have to deal with these things. If you're dealing with these things can improve. So, hemoglobin A1C is an advanced glycation end product. This needs to be understood and hammered in here today. That again, hemoglobin A1C, this is your blood sugar binding to your red blood cell, okay? So really, really important. Now, you can improve this because the lifespan of red blood cells is approximately 120 days. So that's about 3 to 4 months, roughly. So within a 3 to 4 month time span, your A1C and your blood sugar and your symptoms can improve, and many, many things in the body. I just had a patient come to me yesterday, and I saw her 2 months ago for the first time. And 2 months ago, her A1C was at a 7.5. Now within 2 months, her A1C was just rechecked and it's down to a 6.5. And that's just 2 months time span. She was not on any medication. We were just taking the necessary steps to get to the root causes of her problems. And I'm going to be discussing this a little bit more today. But in order to get to the necessary steps, we have to do the proper testing. I'm going to go over the testing as well here today. So you want to decrease insulin resistance. If you don't have to go on insulin, I recommend that you would not like to do that, okay? There's a lot of negative effects that come with going on insulin, insulin in general, okay? And so there's a lot of ways that you're able to address these underlying issues so that you never have to go on insulin, you're never dependent on insulin, and that your insulin improves, this insulin sensitivity improves, okay? So Humalog, Novolog, Lantus, Levemir, Adipra, Novolin, these are all really common insulin medications. So now the next major important thing that needs to be discussed is that when you're on insulin, high insulin is extremely inflammatory, okay? Now inflammatory, inflammation, in Latin, this means to ignite, to set fire to heat up, okay? Inflammation, there's 5 major markers of inflammation, and those are, say, if you sprain your ankle, for example, what's going to happen? It's going to get red. It's going to get hot, okay? It's going to get swollen, okay? It's going to be painful, okay? And most likely you'll lose function on that body part. So insulin causes systemic inflammation. It's not just one body part. This is all over the body. So inflammation or increasing inflammatory levels or inflammatory load causes a lot of problems, okay? Brain fog, joint and muscle pain, bloating. High insulin, as we mentioned, also leads to more insulin resistance because it becomes desensitized, as we discussed. So when people are able to manage and get their insulin levels better and more improved, brain fog, joint muscle pain, bloating, these things all go away because these are caused by one underlying condition. You see, we're not going after brain fog one way. We're not going after just joint muscle pain. We're not going after just bloating because these are all coming from one singular root issue. So that's why we have to address this from the root cause, from the bottom up, from the inside out, not from the outside in, not from the top down. So consequences of insulin medication, cardiovascular disease. So insulin, we said it's highly inflammatory. This increases your sodium retention, which causes bloating, which increases your high blood pressure. So you're on insulin medication, now you might need high blood pressure. It increases clotting. So now you have an increased risk for stroke and heart attack. So now you're potentially on a clotting medication. And it increases cholesterol and triglycerides. And we talked about this. And again, now you're on a medication for cholesterol and triglyceride management. In females, insulin increases estrogen. And we talked about this a little bit, but this creates polycystic ovarian syndrome oftentimes, which increases testosterone, DHT, androstenedione. These are primarily male hormones, but females have them, but everything must be in balance. So this causes insulin resistance. In males, insulin resistance actually increases conversion of testosterone to estrogen. So there's a direct relationship for males between body fat and estrogen production and that's again directly related to high insulin. So if a male has high blood glucose over time, this creates more insulin, and as we said, more fat deposition, more lipogenesis, which in turn creates and transfers that testosterone and turns it into estrogens. So you don't want to be doing these things in the body. These are not normal types of things, which is why we need to get to the root issue so that we can convert the normal hormones into what they should be doing. And insulin, high insulin, also raises cortisol levels. This degeneration causes damaging effects to the hippocampus in the brain, which is directly related to Alzheimer's. It's toxic to the gut and it lowers thyroid production. So high cortisol in the body is related to stress. Now, high insulin can increase cortisol, and what cortisol does is it actually blocks the production of certain thyroid hormones and blocks the conversion to convert inactive to active thyroid hormones as well. You see how there's so many pieces to the puzzle to type 2 diabetes and prediabetes than just you have high blood sugar and high A1C, so take a medication. There's so many pieces. And this is the good news though, that there's so many things that can be done to help improve these, to help so that you can improve this. So you don't have to live with this for the rest of your life. High insulin makes us fat. As we said, high insulin increases what's known as lipogenesis. And high insulin also leads to what's known as leptin resistance. So leptin is a hormone that is in your body and it tells your brain when you're full. So if you eat a meal, as soon as you're done eating that meal, leptin should start kicking in and telling your brain, hey, I'm full, I'm satiated, I don't need to eat any more food. Over time, high insulin starts decreasing that leptin sensitivity, another hormone. And so what it does is now leptin is not telling your brain, I'm not hungry anymore. Leptin's not working. So you just keep eating and eating and eating. So you're hungry all the time. You're never getting full. And again, more lipogenesis, more high blood sugar, more high insulin. You see how this is a big revolving circle that needs to be broken. So high insulin also impairs the production of glutathione. Now, glutathione is the body's master antioxidant. What this does then is it decreases your liver function. When you decrease liver function, you're not able to process toxins. Now, many toxins are located in your fat cells. And as a result, when you're not able to process more toxins, this deposits more into the fat cells. And now what happens is this increases the overall toxic load and the toxic burden in the body, leading to more weight gain. Okay, this is a really important point here. So we need to get to the root issues here. We cannot just be relying on medication to fix these things. Furthermore, oftentimes prescription medications have damaging effects to the liver. They're very hard on the liver, which adds to this toxic load. Glutathione is a crucial immune modulator as well. And with low glutathione status often results in autoimmune diseases, such as type 1 diabetes and latent autoimmune disease in adults, which we talked about, type 1.5 diabetes. And it's also a powerful antioxidant. Now, at the beginning, we talked about hemoglobin A1C and advanced glycation end products. And we talked about how advanced glycation end products create oxidation in the body. Now, the only way to balance oxidation is to have antioxidation, or the opposite, antioxidants. And glutathione is a master antioxidant, a very powerful antioxidant, which helps to counteract that oxidative stress. But if we have high blood glucose and high insulin as a result, this increases inflammatory load and thereby impairs glutathione to counteract that oxidative stress caused by the advanced glycation end products. So we talked about this. High insulin interferes with essential fatty acid as well, causing inflammation, which promotes weight gain and insulin resistance, causing things like joint muscle pain, brain fog. High insulin has been linked to cancer, carcinogenesis, especially colon and breast cancer. So that's why the rates of these cancers are higher in prediabetes and diabetes patients. High insulin levels also interfere with serotonin and dopamine levels. Low serotonin gives you symptoms such as depression, insomnia, mental fatigue, poor executive function, decreased pain, and inhibition. And low dopamine gives you a lack of motivation, lack of pleasure, and movement disorders. Another prime example, if you're dealing with depression, insomnia, anxiety, mental fatigue, brain fog, you might go to your doctor and you might say, hey, I have these symptoms, and your doctor is going to give you an antidepressant or an anti-anxiety medication. These are commonly known as SSRIs, or selective serotonin reuptake inhibitors. Now, what could be the root cause of that serotonin in the first place? It could be insulin, high insulin related to blood sugar dysfunction. It could also be related to vitamin shortages, which can be related to insulin dysfunction. So you see how we have to address the root issues, and we're presenting multiple different points here that are a result of insulin resistance, insulin levels, and blood sugar levels that directly are related to diagnoses and symptoms. So I hope this is making sense for you. High insulin also promotes the aggregation of Lewy bodies and beta amyloid plaques in the brain, and these are seen in Alzheimer's and Parkinson's disease. So we talked about how Alzheimer's is affected, a certain part of the brain is affected, which is the hippocampus, by high blood sugar and high insulin. And this is why Alzheimer's is now known as type 3 diabetes, or diabetes of the brain. And why there's about a 600% increase in the risk of developing Alzheimer's if you have diabetes. So you don't want to go down these paths. There's other ways to address these things. So as we discussed, if you have high blood sugar or type 2 diabetes, the first line of defense and first line of treatment for this is medication, all known as metformin, which is also used in PCOS. It's the first line of treatment often. And this does two things. It improves the receptor site sensitivity to insulin. It also decreases the glucose production in the liver. Now, it does do these things, yes, but at what cost, okay? Now, number one, there are side effects. And number two, the big thing is we are not addressing the root causes of why the blood sugar is high. You get side effects, including diarrhea, abdominal pain, and gas. It decreases folic acid and B12 absorption, which are required for nerve function, for blood cell function, many, many different things in the body. You shouldn't take it if you have liver or kidney problems. There's a boxed warning that says you can develop lactic acidosis, which is a very extreme problem that you don't want to deal with. But here's the biggest kicker here, and that is the typical reduction. If you're taking metformin, the typical reduction in A1C, hemoglobin A1C, is only 1.5 to 2%. So if your A1C is at a 6.5, okay, or your A1C is, let's say, even, and you've been recently diagnosed with, and that is diabetes, 6.5. But say you have a 7 or an 8 or a 9 or a 10% A1C. If you're only decreasing that reduction by only 1.5 to 2.7, guess what? You still have diabetes. It didn't do anything. You still have the damaging, highly damaging effects of the advanced glycation end products. You're still not addressing the root issues. You're still getting the side effects. You're still having problems in taking this with other medications. And if you have liver problems or kidney problems, which we've talked about, so it's not even getting close to actually resolving it. I've worked with patients and clients where we've gotten their A1C down 5 to 6%, not 1.5 to 2. Okay, you can do that with little effort, 1.5 to 2%. And I just told you, within 2 months, we've taken this patient that I saw yesterday, her A1C down a whole percent point within just 2 months, not even touching medication. She was never on medication in the first place. So as you can see, metformin, this is the first line of treatment, and oftentimes people are on metformin for their entire lives. And if you recall at the beginning of the video, the average cost for a type 2 diabetic yearly is $13,700. Now, that is mind-blowing again, because you're not just on one medication. You're having multiple different side effects on multiple different medications, potentially having procedures and operations to remove toes and feet and all this other stuff because of the side effects, because you're not getting to the root issue. So I'm really hammering this in today. I hope this is making sense, that this is really important. We really need to address the root causes, and that starts with the proper testing. And the proper testing, as we'll go over, includes different things, but proper testing is not just testing for blood sugar, fasting blood sugar, and hemoglobin A1C. There's a lot of other things that need to be done. If someone breaks their leg and they go to the ER and the ER doesn't take an x-ray, or worst of all, the ER takes the x-ray of the wrong part of the body or with the wrong view. There's many different views of x-rays that can be taken. So if you're taking a view that's not going to show where the fracture or the broken bone might be, then you're going to miss that diagnosis. You're going to miss where they need to be treated in the first place. The same thing goes for laboratory diagnosis and laboratory diagnostic information. If you are getting labs done, but they're not the right labs, they're not looking at the right thing, then again, you're going to miss the root issue. You're going to miss how to take care of that chronic health condition. So this is really, really important. So there are natural alternatives besides the metformin, and they don't include side effects. Berberine, cinnamon, green tea, bitter melon, inositol. These are some compounds that I use with patients and clients when we're addressing the root issues of their type 2 diabetes and prediabetes, as well as type 1 diabetes that we discussed. Now, there's other types of medications besides metformin. There's rapid-acting insulin. There's long-acting insulin. There's type 2 diabetes medication. There's sulfonylureas. There's lots of different kinds here, okay? And these act in different ways on the body. But again, the bottom line is that they're not trying to address, not even attempting to address the underlying issues. So we talked about the type 2 diabetes, type 1.5, kind of this monkey wrench, okay? This latent autoimmune diabetes in adults. And this affects both the insulin resistance and autoimmunity against the pancreas. So it's a combination. There's an autoimmune component and there's an insulin resistant component. So it's a combination of type 1 diabetes, which is purely autoimmune, and type 2 diabetes, which is mostly insulin resistant in nature. Now, latent autoimmune diabetes in adults has autoimmunity, but autoimmunity to what? It has autoimmunity to the pancreas, and this deals with what's known as the GAD or GAD65 enzyme. The GAD65 enzyme is used to make what's known as GABA, which is a neurotransmitter in the pancreas and brain. Okay. Now, GABA is the body's most abundant inhibitory neurotransmitter, and it's very important to help to regulate and keep our bodies in a healthy, what's known as parasympathetic arrest or digest state. So what this does is it increases blood sugar, creates possible neurological symptoms like ADD, anxiety, OCD, movement disorders, because when you have a decrease in GABA, you have an increase oftentimes in the opposite, which is known as glutamate, which is the body's most excitatory neurotransmitter. So when something's very excited, it's not able to focus. It's not able to be calm. It's not able to stay on track with things. And this develops things like anxiety and these neurological symptoms, this inability to have attention focus. Okay, so you want a healthy level of GABA and you want a healthy level of glutamate, but in this instance, this actually starts to decrease GABA, okay? You can also have mutations with this enzyme. So we look at this enzyme in laboratory testing. Latent autoimmune disease, diabetics in adults. It creates damaging effects to the pancreas. It damages the islet cells, okay? And this is what create insulin, help to create insulin in the body. So you have beta cells, you have islet cells, there's different cells in the body, but basically it starts to damage the insulin productivity as well. So the four major tests are C-peptide, GAD65 antibodies, islet cell antibodies, and insulin antibodies, because we want to be looking at the autoimmune component here. Is there an autoimmune component to your type 2 diabetes or your prediabetes? This is often missed, and they say approximately 33% of all type 2 diabetics actually have type 1.5. So that's really important to know that about a third of any type 2 diabetic out there also has autoimmunity to the pancreas and to these antibodies. So, as we just mentioned, some form of autoimmunity and type 2 diabetics, you get severe glucose fluctuations. And these types of diabetics, these 1.5, these LADAs, they tend to be thinner diabetics, okay? And they so oftentimes suddenly need more insulin. So if you are working out or you've eaten a meal and your insulin should be at a certain rate, but sometimes it's all of a sudden you have a fluctuation, high fluctuation. It's very, very common in these types of diabetics. So again, this is rarely checked for by traditional medicine and has no answers. Again, when something is not checked, there's often no answers for it. So they will just ignore it. Okay, so this is really important that we must address this though. We cannot just ignore that there's a potential autoimmune component to type 2 diabetes. We can't just ignore that there's all these underlying issues that are often occurring behind the scenes with diabetes and pre-diabetes that can not just be resolved by taking a medication. So utilizing functional medicine, we can identify and remove these triggers through proper testing. So the bottom line is you really have two choices, you know, and I often want to reiterate this point that we've talked about, that the traditional mainstream model of care is not even getting close to or even attempting to get to the root issue. I encourage you, if this made sense, that you take the necessary steps to get to the root issue of your diabetes or pre-diabetes, because there is hope. There's many things that can be done. So we talked about the 10 different underlying causes of high blood sugar that are not related to diet and exercise. We discussed these. Now let's go a little bit more in depth. Thyroid dysfunction. So both hypo, low, and hyper, high thyroid will increase insulin. This causes insulin resistance. So thyroid hormone is, your thyroid gland is located in your neck, and this is your body's internal thermostat. So when you increase the thermostat, your metabolism starts to increase. When you decrease the thermostat, the metabolism starts to decrease. So when thyroid hormone is low, this often decreases the metabolic rate, which can cause fat deposition, lipogenesis, but also high blood sugar and insulin resistance. Now, there's many different ways that the thyroid can go awry. And this is why we also run a comprehensive, and have people run a comprehensive thyroid panel so that we can get to a big picture on what is actually occurring with the thyroid. And I have another very long video which I discuss how to get to the root issue of thyroid conditions on my website. I encourage you, if you're dealing with a thyroid condition, to watch that as well. So the liver plays a crucial role in regulating the body's blood sugar. Toxins and the buildup of fat in the liver make it harder to control fasting glucose levels. It also makes the body more resistant to insulin. It's speeding up or worsening type 2 diabetes. And this was a quote from diabetesforecast.org. Now, we talked about how when you have an increased toxin load, this places more stress on the liver and thereby places also more fat deposition. You can see the liver plays a crucial role in blood sugar as well. So common cause of liver dysfunction, high triglycerides, which can be related to that high glucose or high meal. Just a large meal in general can cause fat and glucose deposition. Toxins in food, pesticides, medications, these all are a burden on the liver. So the liver is the body's major detoxification organ. So any food, pesticides, herbicides, medications, advanced glycation end products, alcohol, caffeine, nicotine, sugar, nearly everything in our environment gets placed to the liver to be processed. When that gets overburdened, this creates problems. This is why we were able to test for all these things with our patients. Viruses like hepatitis C, Epstein-Barr virus, cytomegalovirus, herpes virus, and HPV, all of these things can damage the liver. So proper testing and natural liver detoxification are crucial. Number 3 is poor adrenal function. High cortisol, as we talked about, increases blood sugar or blood glucose. This can lead to insulin resistance. So what are some causes of adrenal stressors? Lack of sleep, low oxygen. If you're not breathing properly, many people who have overweight or obese, problems have decreased airflow. This can cause things like sleep apnea. When this happens, just think about holding your breath for 20 seconds. That's very stressful on the body. You're not getting that much oxygen to the brain at that time. So poor breathing, COPD, even anemia. In anemia, you're carrying around less oxygen in your red blood cells. When you're doing this, this is a problem. It's caused a lot of stress on the body. So we have to address anemias as well. Caffeine, alcohol, nicotine, sugar, these all create more stress and can increase cortisol. Poor diet, anxiety, emotional stress, loss of a loved one, loss of a job, moving to a new state, moving in general, all of these things can increase cortisol. And B, vitamin deficiencies. Again, we need to look at all of these issues, including vitamin mineral deficiencies and other nutrient deficiencies in the body, essential fatty acid status, antioxidant status, many other things, because these can all create more stress on the body because it's not functioning properly. So we must identify and remove as many causes as possible. Number 4 is systemic inflammation. Food sensitivities, often gluten, dairy, soy. We're able to identify these with all of the patients and clients that I work with. Vegetable oils, hydrogenated fats, sugar, dental, gut infections, dysbiosis. I see many people with dental infections, dental overgrowth of some sort, as well as gut infections. You see your mouth is directly related and is part of your digestive system. So your digestive tract is made up of your mouth, esophagus, stomach, small intestine, large intestine, colon, and anus. So the entire digestive tract can be impacted. If one area is impacted, the rest can be impacted. Leaky gut syndrome, which is known as hyperpermeability, autoimmune disease. These all lead to insulin resistance and all need to be checked via proper testing. Number 5 is autoimmune disease to the pancreas. We already discussed this. There's different types of testing that need to be done, but this has to be looked at if you're dealing with prediabetes or diabetes, because as we said, about 1/3 of all diabetics have this problem. Poor digestive function. Now, prebiotics are known as undigested fiber. Probiotics or microorganisms use prebiotics to produce healthy bacteria, more healthy bacteria, and a healthy microbiome. Now, probiotics, as a result, will consume prebiotics and produce what's known as short-chain fatty acids. These are known as postbiotics. And so when you have poor digestive health, this actually starts to have a negative impact on your blood sugar, your insulin levels, and type 2 diabetes. So there are over 138 published scientific articles on the gut microbiome and obesity and diabetes, also known as diabesity, on PubMed, which is the largest database of unbiased medical research online. So DNA stool testing is another thing that we utilize for patients and clients. It's crucial to identify poor gut microbiome and then to correct it. Many people I work with have all sorts of gut infections, bacteria, viral, fungal, yeast, you name it, parasites. We need to get to the root issue of these things in order for these things to resolve on their own. Nutritional deficiencies. This is a really big one. We talked about how medications oftentimes, very oftentimes, and I have other videos on my website that discuss these in depth and go over the research that shows that each medication and what nutritional deficiencies it creates. Alpha lipoic acid, inositol, chromium, magnesium, CoQ10, related to statin drugs. These are all nutritional deficiencies that can cause and be caused by not only medications, but also prediabetes, type 2 diabetes, and insulin dysfunction in general. So you need these nutrients and these vitamins and minerals in order to properly manage blood sugar and insulin in the body. So it's really important that we are able to identify these things. Medications that raise blood sugar, corticosteroids, ADHD medications, antidepressants, birth control pills, high blood pressure medications, especially beta blockers, thiazide diuretics, cholesterol-lowering medications like statins. So corticosteroids, This is synthetic cortisol, much stronger than your body's natural production of cortisol. Your body's natural production of cortisol increases blood sugar. Now, add on a synthetic cortisol, corticosteroid, which enhances that dramatically, and you're going to have problems. ADHD medications, Vyvanse, Adderall, Ritalin, these are all really common given to younger populations, number one, and the younger populations now have a massively increased rate of prediabetes, obesity, type 2 diabetes, and more. Okay, there's a massive picture here that I hope is taking place if you're watching this, that we have to get to the root issues of these things. There's many things going on that just, oh, this person has a concentration issue, so give them ADHD medication. We have to get to the root issues because there's a lot of other side effects, and there's a lot of other chronic health conditions that are the direct result of a underlying issue that could have been addressed, and you might not have to have that. So a lot of problems here, a lot of problems here. Polycystic ovarian syndrome. So this is known as the great mimicker of hypothyroidism. So we mentioned earlier, up to 10%, if not more nowadays, of young women have polycystic ovarian syndrome. This is related to obesity, high levels of inflammation, and causes unhealthy follicles in the ovaries. Can lead to insulin resistance, and as a result, converts estrogen into testosterone. And when females have higher levels of conversion of estrogen into testosterone and in imbalanced ratios, this creates things like infertility, hair loss, facial hair, weight gain, acne, which are all very common symptoms of PCOS in females who are dealing with these types of things. So you can see we have to address these root issues. We have to look deeper. What is a typical medical management for PCOS? Birth control pill. And what does the birth control pill do? It increases estrogens more, but as a result, again, converts that more to testosterone. Spironolactone, metformin, we talked about this. Again, functional medicine, this uses a whole body approach, an underlying cause approach that gets to the root issues of these things. Now, this is a really important point here that I hope will resonate with you, and I hope you understand. If you've heard that there's nothing more we can do, remission is not possible, you have to take these medications for the rest of your life, this is coming from that mainstream model of care. In this presentation today, I've already shown you so many different ways in which we can get to the root issues of your type 2 diabetes or prediabetes, or even your LADA, your latent autoimmune diabetes in adults. So it's not enough. This is not a reasonable thing, and it's not responsible to just say, just take this medication. And I hate seeing patients who have been down this model of care that they've been told these things, because there's so much that can be done. And I work with people on a daily basis that are getting off their medication. They're improving their lives. Their symptoms are going away like ease, and they're getting their life back. And they're not spending tens of thousands of dollars recurringly every single year on these chronic health conditions. So there's ways that these things can be resolved. I wish I had a glass of water, by the way, right now. So number 10 is neurologically induced high blood sugar. Now, we talked about this a little bit already, but the autonomic nervous system is made up of two parts: the parasympathetic, which is known as your rest and digest, and your sympathetic, which is known as your fight or flight system. Now, when blood glucose gets out of balance, what happens is that these scales start to tilt, and you start to get more of a sympathetic dominance. When you get sympathetic dominance, okay, this creates a fight or flight response, increases cortisol. So an example of this would be, if you saw a bear in the woods, your cortisol would ramp through the roof, your stress hormones, because what it's doing is it's preparing you for survival. That is your fight or flight system. So if you see a bear in the woods, you're either going to fight it or run or freeze. At that moment in time, your body is not worried about reproducing. It's not worried about breaking down your food or anything else besides surviving. So blood is shunted to the muscles. Blood sugar is shunted to the brain so that you can think, you can focus, you can run, jump, get away from that. Over time, this creates a huge problem because now we have chronically elevated blood sugar or blood glucose as a result of this high cortisol levels. This causes brain decline. So some symptoms of this are high blood sugar, high blood pressure, dry eyes, dry mouth. Remember, we talked about when this is occurring, your blood gets shunted away from the internal organs. Blood glucose increases because you have to think more. You have to, your body is basically in a fight or flight system, fight or flight moment. Dry eyes, dry mouth, snoring, sleep apnea, difficulty swallowing, digestive, bloating issues, constipation, gas, acid reflux, frequent urination, sexual dysfunction, cold hands and feet, hair loss, insomnia. All of these are major, major problems that can be resolved by getting to the root issue. So there's 5 major tests. We've been talking about all these underlying issues today, but I want to go over some major tests that everyone with high blood sugar really should be getting done. Number 1 is comprehensive blood work. And when I say comprehensive, I mean comprehensive blood work. I see blood work on a daily basis. And when people are going to their doctor's office and getting their annual blood work done, this is very, very basic blood work. This is the same blood work that you're going to get if you go to the ER. It is not comprehensive. So we have to get comprehensive. And I go over what comprehensive is with everybody I work with, but it basically involves many more markers than what you're currently most likely getting. I use the example of if someone fractures their leg and they go to the ER or their doctor's office and the doctors say only wants one x-ray view or they run the wrong view, they're going to get an improper view on what's going on, and they're going to get a improper and the wrong diagnosis potentially of what needs to be done as well. The same thing applies to blood work. The next test is autoimmune tests. This is GAD65, insulin, and islet cell antibodies. We discussed these as well. An organic acid test gives us kind of a blueprint of the entire body. This is a blood and urine test that measures over 70 key metabolic markers. So as we discussed, if your metabolism in the body is not working, we need to adjust and find out why that is. Food and chemical sensitivity testing. We talked about the liver, toxins, how these things can play a major role. Any of your foods, any of your chemicals that you're exposed to on a daily basis, whether that's environmental or home chemicals, there's many, many different things. And we look at over 400 different foods and chemicals that could be affecting your body. And finally, vitamin and mineral status. This is hugely important. Your vitamins and minerals literally run every single metabolic pathway in the body. Medications and nutrient deficiencies oftentimes will downregulate and not have these things running properly. So we have to look at how these things are working together. And we tie this in with organic acids, with food and chemical sensitivity, along with others. Now, again, these are basic laboratory tests that we use for many different patients and clients, but these can vary. Sometimes patients need more, sometimes they need less, but this is an overall overview of what you should be getting if you have high blood sugar and are dealing with type 2 diabetes or prediabetes. Now, I'm going to be going over a pretty important point here really quick, and that is laboratory test ranges. Almost everybody I work with will come in and they will show me their previous laboratory tests, and they have been shown up in the normal reference range. And their doctor will say, well, your test results came back and you were on the normal reference range. Now, here's the really, really important point. If you go down to your local laboratory facility and you get your blood drawn, you're getting compared against everybody who's been to that lab in the past year. So you're getting compared against a specific population. Now, who gets their blood ran in this day and age? Well, most oftentimes, sick people get their blood labs ran. Healthy people aren't actively going to get their blood checked most often. So as the population continues to get sicker and sicker, which it does, more chronic disease is occurring in the United States more than ever. Okay, so we are a population of only 5%. The United States makes up only 5% of the world's population. But the United States consumes about 72% of the entire world's prescription medications. Yet we are not a healthy nation. They say that we're about a 38th or 39th in terms of longevity overall. That's life expectancy, and chronic disease rates are extremely high in the United States. So clearly, United States is not that healthy. And so when you get your labs checked, your reference ranges are being compared against that population. So these reference ranges continue to expand and expand and expand every single year. So that's a really, really big problem. That's why you're going to the doctor, you're getting the labs run, but they're coming back and they're saying, well, you're normal, okay? So you're coming within this green range, okay? And they're telling you you're normal. So what I utilize is what's known as functional optimal ranges. Now these ranges are made up by the American Endocrine Society and other societies that are based off healthy populations. So you get an actual accurate representation of whether you are in a normal or a non-normal range. So this is really, really important. So here's a prime example here. Traditional high-low ranges for, say, glucose, 65 to 110. So if you come in at 73, they're going to tell you, well, you are good to go. You don't have diabetes. You don't have any blood sugar issues. Now, a functional range is a little bit more narrow, between 85 and 100. So if you have a 73 fasting blood glucose, we're going to know that you are outside of that range. And we're going to be able to take the necessary steps so that we get you inside of that range. So there's a lot that has to do with this, because we can utilize this not only as a marker for identifying what's currently wrong, but what can go wrong in the future. And so this is really important. We use these kind of as yellow lights as well to monitor whether you're getting to a particular area where we want to avoid. So I hope you enjoyed this presentation. Let's recap. Diet and exercise, yes, are extremely important for diabetes and prediabetes, but they are not by any means the only thing that need to be addressed. The case of type 2 diabetes is where too much insulin is outside and the blood glucose is not responding. The insulin is not responding to the glucose, okay? So it becomes desensitized to it. So taking more insulin only leads to even greater insulin resistance. That's the problem that we have hammered in to date. Almost 1/3 of type 2 diabetics, almost 1/3 of all type 2 diabetics also have an autoimmune component. High blood sugar with advanced glycation end products are extremely destructive to the brain and body. And type 2 diabetic medications have serious consequences to them. If you do not make any changes, again, I mentioned this at the beginning of the video, I'm not recommending that. I'm not telling you to discontinue your medication. I do not monitor any prescription or medication therapy. And if you're currently on medication, I recommend that you discuss with your prescribing doctor, with your doctor who's giving you the medication, on whether you need to be on or off that. Okay, that is most often your and your doctor's decision. I do not monitor that. What we do is we address and get to the root issues of your problems so that you will find the need that you may not need that stuff anymore. So the goal with functional medicine is to address all the possible problems of glucose metabolism in the body, remove them, and then gradually help those recover as quickly as possible. So the underlying causes to high blood sugar are multifactorial. These are many, many different causes. There's never just one size fits all approach to this. As take any chronic disease, including diabetes or prediabetes, and there's always multiple different reasons. There's never one particular cause. Just as you can never give 100 people the same medication or the same dosage, because everybody can have different reasons for why they have that problem. It varies from person to person. And this is where proper testing is absolutely key and comes into play. So I hope this webinar and this video made sense to you. There's a lot that we covered today. So as I mentioned, if you've missed anything, please feel free to go back and look at those. So if this made sense to you today, I encourage you to schedule your discovery call with myself, where we can go a little bit deeper and I can find out about your condition and how we can approach this together from an underlying cause perspective. Once the discovery call is completed, we will have 2 visits. The first one includes a comprehensive history and evaluation, where I'll be taking a very deep dive into your health history. We'll be uncovering any root issues that we need to address together. I'll have you bring in any existing labs. So any previous labs that you've had before, I will request those from you and I will go over those with you and show you what we need to do and how we need to address and where we need to dive deeper to get more testing done and how that needs to be done. I will have you fill out comprehensive new intake paperwork that will be very, very unlike most paperwork you've had filled out, because again, we want to get to the root issue of your problems. And if you have a spouse or significant other, I encourage you to bring them with you. We always like to have the spouse or the significant other present for a number of issues, number of reasons. Not only, the most importantly though, is that they are there for support. They know what you're doing. They know how we're able to address this with you, and they are there to support you. On visit 2, I go over the labs that we need to go over. So I go over a case review and show you the labs that need to be done, the further testing that needs to be done, review of further findings from visit 1, and I go over the big picture master plan that we need to go over with you, the big overview. Now, the commitment is multifactorial, and there is a commitment. You must be willing to make the recommendations and lifestyle changes that I recommend. These are very, very important. They're going to be pertinent and only specific to your particular case and instance. There is a time commitment to this as well. There are continual therapy appointments. I often meet with people for a minimum of 6 months because it takes time to get to the root issues of these things. As I discussed early on, there's often many different reasons underneath the iceberg that need to be addressed. And these things do not go away overnight. So this takes time. And finally, there is a financial commitment. There's a cost of care that I will explain to you. There's different plans available on our visit. So there's a major recovery program structure. And this starts with number 1, the laboratory testing. Without the testing, it's going to be very, very difficult for us to have a good diagnostic approach and picture on what's going on. So this is crucial, absolutely crucial, and there's not really any way around this. We have to get the testing done. Once we're able to get the testing, we can formulate a great plan, a great strategic approach in order to get to the root issues of your problems and resolve them. So this includes interpretation and detailed explanations that follows lifestyle changes, dietary changes, any nutritional supplementation, and any appropriate referrals as well if needed. Now, as I mentioned, follow-up visits usually occur anywhere from 6 to 12 months because we need to stay on top of it. It's very hard to manage your case and to manage your condition if we are not continually meeting and making sure that we are managing it. So this includes accountability, any changes or tweaks to the plan, working through multiple problems discovered on labs. Again, when I work with people, there's never just one thing that shows up on labs. We have multiple different facets, multiple different body systems that we need to work through. Nutrition counseling sessions, health coaching, and mindset consultations, as well as full email access are all included. So if your diabetes or high blood sugar or pre-diabetes issues is having a major negative impact on your life and your current treatment or therapy plan is not working for you, I hope this video served as a message of hope. We covered a lot of information today. This is really, really important information and points that if you're watching this and you're dealing with these problems, I can pretty much guarantee that this information has never been explained to you. And yet I hope this made sense and I laid it out in a format that you can understand. And I know it's very rooted in science and there was a lot there, but there's not really many ways around it. This is how you get to the root issues, okay? So again, if this made sense, I encourage you to schedule your discovery call with myself. This discovery call allows me to determine whether you are a candidate for the program, whether or not I can help you, and it allows me to get acquainted with your health condition and your previous treatments, and for us to schedule that deep dive consultation to uncover the root issues of your problems. So again, I'm Dr. Anthony Crifase. Thank you so much for taking the time out of your busy schedule today to watch this video, and I hope to work with you soon. So congratulations, you've watched the entire webinar. Now, if you have been diagnosed with prediabetes or diabetes, or you have a blood sugar problem, or you're just tired of the same old healthcare model of chasing symptoms with medications, and you want these types of results that I've shown you today, then I encourage you to schedule a discovery call with myself. If you're not satisfied with your current treatment or therapy, or if you're not tired of getting to the root issues of your condition, and if you're tired of hearing that there's nothing that can be done, there's good news. I am here to help you. So thank you for watching, and I look forward to speaking with you soon.